cases and interviews continuing with the remaining 3. 3 of the 16 were infectious in the community. We continue to provide additional support for those clusters of concern that we identified in yesterday's press conference. That support is holistic across the ACT government and many people are doing fantastic things to support those vulnerable community members. And I want to take the opportunity to thank all of those ACT government staff from across multiple agencies for springing into action so quickly over the weekend. As it's a Monday, I thought it would be a good opportunity to outline the priorities for the week ahead as we continue to tackle this outbreak and seek to advance the important areas of community response to the pandemic. So on vaccination, I'm pleased to be able to advise that we are now in a position to open the registration process for 16 to 29-year-olds to receive a Pfizer vaccination at ACT government clinics. So what this means is that around 64,000 Canberrans in this 16 to 29 age cohort who have not yet been vaccinated can register on the My Digital Health record website to receive a vaccination down the track. So this is registration to get into the system to be able to make your online bookings. Around 21,000 Canberrans in this 16 to 29 age group are already vaccinated through the earlier phases of the Pfizer program or through the use of the AstraZeneca vaccine. Opening the registration process will enable more people to be in the system when the time comes to book an appointment. We anticipate that these appointment bookings would open next month. So if you are 16 to 29 years of age, please access the My Digital Health record website, MyDHR, to start this process. Our phone lines are also ready if you need help to set up an online profile. Now, Canberra is a young city. 16 to 29-year-olds are a very big part of our city's population. This is a large number of people. So please be patient as we work through the registration process. We will work hard to support you to register for your vaccine. You will not miss the opportunity to make a booking. Not everyone has to register today, but we do encourage people over the coming days, if you are aged 16 to 29 and are not yet vaccinated and wish to register for a Pfizer vaccine, to take that first step of registering through the My Digital Health record system. Bookings will open when the Commonwealth supply of Pfizer increases. As we've announced, arrangements are being finalised to open a new mass vaccination clinic at the Australian Institute of Sport in Bruce, at the AIS Arena. This will enable an accelerated program of vaccination for 16 to 29-year-olds. Now, at the moment, we have bookings across our existing clinics through until mid-October. We will bring forward as many bookings as we can as Pfizer supply increases. But to give you a sense of this week the ACT government has 17,135 bookings at our clinics for vaccination. At this point in the vaccine rollout is particularly important for healthcare workers, aged care workers and disability workers to get vaccinated as soon as possible. We have also put in place special arrangements for 12 to 15-year-olds with underlying health conditions to receive a Pfizer vaccine at an ACT government clinic. Of course, the AstraZeneca vaccine is available extensively across the ACT through GPs and pharmacists. And thank you to the GPs, pharmacists and nurses who've been running such a strong program across the city. On all matters vaccination, please visit the ACT COVID-19 website for more information on how you can get vaccinated. This is a race and we do need more people to come forward, and we will do what we can to get you vaccinated as quickly as possible. Now, in terms of testing, yesterday 3,740 tests were conducted in the ACT. We are expecting an increase in testing in the coming week as people start to end their 14-day quarantine period, having been a close contact at an identified exposure site. As I advised yesterday, due to the impending rain, there will be some disruption at testing clinics over the next 24 to 48 hours. Some of our pop-up clinics cannot operate with the sort of weather that is forecast for the ACT. In relation to business and public health direction settings, the government continues to work with business and industry stakeholders on the very fine detail of what future public health measures and business support will look like. There are no changes to settings today beyond what has already been announced, but we will outline further details in the coming days as we get closer to the end of the 14-day period since the lockdown commenced. And that 14-day period is this Thursday. So, in summary, we recorded 16 new cases to 8 p.m. last night, 13 linked to the current outbreak, and interviews continuing with the remaining 3. And of those 16 new cases, 3 were infectious in the community. I'll now invite Chief Health Officer Dr. Karen Coleman to provide some further information on the new cases and the epidemiology of our outbreak, and then we'll be available for questions. Thank you.
Thank you very much, Chief, and good morning, everyone. My name's Dr. Karen Coleman. I'm the ACT Chief Health Officer. And just to reiterate what the Chief Minister has said this morning, since our last update yesterday, we have recorded 16 new COVID-19 positive cases. That brings our total active cases associated with this outbreak to 137. Of our new cases today, I can also confirm that 13 of the 16 are linked to known cases or exposure sites of concern, with interviews continuing for the remaining 3. And also, out of the 16, 3 of these were infectious in the community. We also now have 4 people in our hospitals. 2 of these cases are COVID positive, but are not in hospital for COVID-related issues. And 2 people are actually receiving care for COVID-19, but at this time, neither are in intensive care nor receiving assistance or breathing support. Since our last update, we have over 13,500 self-identified close contacts who we're continuing to support in quarantine, and over 6,100 casual contacts. We also now have over 360 exposure locations, now spreading across almost the entire of the ACT. So please, as I remind you every time I get the opportunity to speak with you, please stay up to date on these venues through the ACT COVID-19 website. So I discussed and confirmed a case on the ANU site yesterday. Our teams continue to work very closely with staff and students at ANU, both on this case as well as in general moving forward. Please note that specific areas of the campus will be listed as exposure sites later today. So if you have been on the ANU campus in the last fortnight, please check the updated list later today when it gets out and get tested if you need to. Yesterday, we had a multi-agency response team on site at Condamine Court who worked very closely with many of our community partners, providing information and support to the tenants. This will continue today. I do want to say a really big thank you to our community partners involved. This has been and will continue to be a really critical part to our efforts of supporting our residents on this site moving forward. Our assessment remains ongoing, and it is expected that Condamine Court will also be listed as an exposure location once this assessment is complete. Once again, please make sure that you check the times and dates provided and take appropriate action if you have visited that site. Also, as we discussed yesterday, we are continuing to work with the disability sector in regards to a cluster of cases. Further to that, to which I spoke to yesterday, there is one more additional support worker who has been confirmed as COVID-19 positive in our numbers we are reporting today, which brings our cluster to a total of 15. We do continue to work with those directly affected and the wider sector with a focus on reducing the risk of transmission and providing support. But I would like to acknowledge that the impacts on the sector are wider than those who are directly affected, and we are committed to continuing to work through these impacts and support where we can. So to provide a broader update on the outbreak, we still have our 3 cases in surrounding New South Wales region which are linked to our ACT outbreak but are not included in our numbers. There is very little change in the proportion on age groups, and the number of public sites of transmission remain at 8. So today the Chief has reported 3,740 tests carried out yesterday. While this is a solid result and comparable on a population base with other jurisdictions, we do need testing numbers to remain high at this point in time. We are aware there is active community transmission in the ACT. It's really important for our surveillance that anyone who has been to the exposure locations and anyone who is unwell with any of the symptoms of COVID-19 get out there and get tested to ensure that we are picking up any cases that are currently going undetected. Once again, please check the ACT COVID-19 website for details on the opening times and testing site locations that are open on a day-to-day basis for the public. And finally, just to echo the Chief Minister's comments on vaccination, with the 16 to 29-year-old age group now open for registrations through the online My DHR registration process, this will make it faster and easier for those of you in this group to make an appointment when you do become eligible after the next couple of weeks. And my shout out for today goes to the epidemiology team that actually enables me to present this in-depth information to you and keeps all of us informed about how the outbreak is going and to understand what our risks are moving forward. Thank you. I'll hand back to the Chief for questions.
Thank you, Dr. Coleman. We'll start on this side of the room. Lucy.
A lot of 16 to 29-year-olds might be tossing up today whether they register for Pfizer or just go and get their AstraZeneca shot. Has the ACT government got any modelling or any idea as to whether these people would be fully vaccinated first if they get Pfizer or if they get AstraZeneca?
Well, let me look at the current intervals that are clinically recommended for the 2 vaccines. That I think at this point most people would still be better choosing AstraZeneca today based on our current projection of Pfizer supplies. We keep on hearing that Moderna may come into the mix as well, and I understand as an mRNA vaccine type that it's likely to have a shorter interval between first and second doses than AstraZeneca. But clearly the best vaccine is the one that you can get today, and it does give you first dose protection. But look, if we get more Pfizer, having people in the system is helpful. It means that as appointments become available, we can bring forward, we can contact you. So I would recommend that people register for the My Digital Health Record. It's obviously an individual choice around which vaccine, and it should be based on discussion with your trusted health professional. But there are vaccines available today, but it's also important that people are registered into the system as well, because it will be a combination of AstraZeneca, Pfizer and presumably also Moderna that will cover this age group. And then, of course, we have been ambitious in our desire to see 12 to 15-year-olds vaccinated as well. And in light of some of the commentary that's emerged this morning and overnight about the national plan, we are going to have to pick up speed on getting vaccines to 12 to 15-year-olds as well. But at the moment, Pfizer, I understand, is the only one that has TGA approval, although Moderna may be also seeking that approval, I understand.
Chief Minister, the New South Wales Premier says to get to their 70% double dose rate, they're looking at the end of October, but could be sooner. What are our projections looking like, and are you still confident in that 70% target? Would that bring us out of a lockdown?
Okay, so a number of elements there. Based on our current national leadership on first dose coverage and the age cohorts that still remain, I think we would be, if not slightly ahead of New South Wales and at around that New South Wales pace. A little will depend on the enthusiasm of the population once the sort of initial very eager and first movers have been vaccinated. So based on our current trends, we'll be pretty well positioned to certainly be ahead of the national average. It might be touch and go as to whether New South Wales or the ACT gets their first on second doses. I do note that New South Wales have, out of necessity, had to adjust their intervals for second dose Pfizer in order to meet the crisis that they are facing. So as I understand, their approach is that their second dose Pfizer won't be after 3 weeks, it will be after 6. So that will presumably see their first dose number increase, but then their double dose number take a little bit longer to reach that 70% mark. Of course, contingent upon the Pfizer supplies, whether the Prime Minister dumps more Pfizer into New South Wales, as he has been doing previously, based on the advice of the Commonwealth Chief Medical Officer. It also depends on the take-up of AstraZeneca in New South Wales and the ACT. On the question of lockdowns, again, I refer people to the national plan. The national plan says that at 70% double dose, lockdowns are less likely but possible. At 80% double dose, the national plan says lockdowns are highly targeted only. So I think it is very important, as I have been stressing throughout this process, to understand the detail of the national plan. And it has been very disappointing that both some senior politicians in Australia and some media outlets have glossed over the detail. And I think that has led to a lot of confusion in the community.
Are you still confident in that plan and those targets?
So our rationale for signing up to the plan is that there does need to be a pathway forward. Our rationale for signing up to the plan is that when properly implemented, in the detail that is there, it does represent a way forward for the ACT and for Australia. The points of difference that are emerging at the moment cover a couple of key areas. And I think it's important to outline what that actually means. Now, I have put on the public record, and I will do so again today, that I think all Australian governments should make more effort to vaccinate more 12 to 15-year-olds with the TGA-approved vaccines once the supply of those is available. And I would like to see a much higher rate of vaccination amongst that cohort. Secondly, I have made the point about the effective vaccination rate, not the nominal rate, that it takes 2 to 3 weeks for the vaccines to become effective. So I think you could summarise the difference between my position and what I understand the Prime Minister to be saying is effectively about 3 weeks of vaccinating. That we could comfortably be above 70 and 80% effective vaccination of all Australians 12 years and over if we run our vaccination program full tilt for 3 more weeks. That's what we're talking about here. And then we will be in a position to be confident that 70% of 12 plus are effectively vaccinated. And that's the difference those 3 weeks will make. The Doherty Institute modelling says it's then a further 3 weeks only, and possibly even less if we have really high levels of vaccine uptake, between 70% and 80%. So all of this argument, all of this debate, I think is going to boil down to 3 weeks or 6 weeks between effective 70 and effective 80 across Australians 12 years and over. And if we all get our skates on the vaccination program, which there is absolute agreement across the National Cabinet, across the Federation, I'm on a unity ticket with the Prime Minister on everyone should get vaccinated. I think it's also important that we look at the detail of the national plan, that it not be glossed over. And on that point, I'm on a unity ticket with the Prime Minister in his statement in his press conference today that there's not a freedom day, it's a gradual easing. So they are 2 really important points of agreement. Now, I know the media loves to cover the disagreement, but let me put the points of agreement on the public record. It's the fine detail of this, and it's 3 to 6 weeks extra vaccinating to protect our kids and to make sure that we are genuinely at 70 and 80%. That's what's in dispute. And I'm very comfortable with the ACT's position and the case that I am arguing that those 3 weeks are worth it, are worth fighting for 12 to 15-year-olds and for all of the unvaccinated in Australia.
The Prime Minister also said that with high rates of vaccination, Australia should not fear the prospect of cases rising and instead they should embrace it. What do you make of those?
Well, I don't think Australians want to embrace more people getting infected with COVID and more people finding themselves in hospital and intensive care or dying. So I wouldn't have used that language, embrace more COVID. I don't think anyone does that. But understanding that there needs to be a transition, of course there does. And as I've just outlined, I think in quite some detail, the points that I am arguing, and I'm not alone in this, it's not me versus the world on this, there are many, many people who share my view. And all of this for the sake of 3 to 6 more weeks of vaccinating would have us in a much stronger position as a nation and would protect more people. I think that's worth fighting for.
When it comes to protecting people in the disability sector, advocates say that they weren't told about the cases in the disability community in a timely way. Why was this?
Well, look, I don't necessarily accept that interpretation. We need, obviously, as the Chief Health Officer has indicated, we need to gather information and have a better understanding of exactly the nature of a cluster or an outbreak before we can provide meaningful information. And I think it's the quality of information, not whether it came 1 minute too early or too late, that is the most important thing here. So look, I'll take on board that feedback. We're not withholding information, but we do want to make sure that information we convey is accurate to the best of our knowledge and understanding at the time, noting that things can and do change, that new information becomes available all of the time, and that we may need to further update as that new information becomes available.
I understand the vaccination of the disability community is a responsibility of the Commonwealth, but do we know how many people in the disability community in the ACT are actually vaccinated, and if not, why not?
Well, we will have some data on that. Clearly, we have above Australian average levels of vaccination, and that's generally the case across all different cohorts in the ACT. But we have the most granular information when we're running the program. When it's the Commonwealth running the program, you might need to seek that level of granularity from them because we would rely on information provided from the Commonwealth. They do, of course, provide a daily, quite detailed report. that updates the vaccination statistics. So that might be a good place to start to look for that data.
The construction site that's reopening today for the Commonwealth is requiring workers to show that they've had either their first jab or they've got a booking for their first vaccine. Is this something that the ACT government is looking to implement for when our construction sector reopens? And will you be looking at, I guess, the example of the TGA facility as a way to see how the ACT can also reopen construction?
In short, yes and yes. We need to look at the best COVID-safe practices that are being applied in our jurisdiction across some of these essential projects that are able to continue under the current public health directions or to recommence under the current public health directions with excellent COVID-safe plans. So yes, this is the fine detail that we're talking about. Compliance with the range of rules and regulations in the construction sector isn't always 100%. I think Canberrans know that, and so we need to be confident, firstly, that it's a good, workable plan. And I want to thank the particular construction companies and the industry stakeholders who've been working well with us on what those sorts of arrangements should look like. That's one part of the equation. The other part is, will these rules be complied with? Because there's sort of no point having them unless they're going to be complied with. And then that is also then a factor for us of how many inspectors, how much compliance activity can we do to ensure that people do the right thing. And across the construction industry, like society more broadly, there are people who are excellent, who have absolute and utter commitment to workplace health and safety. And then at the other end of the spectrum, there are some who think it's an optional extra. That's the risk that we have to balance here. But to the credit of the construction industry, the serious people in that industry, they're working very well with government on the fine detail of how we can make this work.
And given, as you were saying, you've been advocating for children 12 to 15 to get the vaccination, but this outbreak is spreading among children, and we saw in Victoria over the weekend that they're going to change their advice for masks in children under 12, not making it mandatory, but making a strong advisory. Is that something you would follow?
Well, I'm not announcing that today, but we continue to look at what our public health settings will be beyond the lockdown. These are all things that we have to give detailed consideration to. The factors that influence that are the conditions inside the ACT, the conditions in regional New South Wales, and what else is happening elsewhere around the country. And of course, where we are in the vaccination program and the broader steps in the national plan will all be factors. But again, if I come back to the national plan, it still talks about, even at the 70 and 80% benchmarks, minimise cases in the community through ongoing low-level restrictions and effective track and trace. Minimum ongoing baseline restrictions, even at 80%. That's there in black and white in the national plan. It should not be glossed over, and there should not be a suggestion that having those measures in place is somehow not adhering to the national plan, which is what is being suggested, unfortunately, at high levels in this country at the moment.
Mr. will you stick to your guns on saying that you won't make working in specific sectors compulsory or rather having a jab compulsory to work in those sectors given the health situation? We've heard from some healthcare workers that they're frustrated when colleagues aren't required to be vaccinated.
Look, when this question was asked yesterday and the day before and the day before that, I said we will look at the situation as we get further into the vaccine rollout. But you can't make something mandatory if not everyone has even had the opportunity yet to get vaccinated. But can I be as clear as I possibly can, staring right down the barrel of the cameras? Please get vaccinated. Please. We need to do this for each other, for this community. And even if you don't care about the community and each other, think about yourself and your family and your friends. Please get vaccinated.
Chief, there's been some more talk from the PM and New South Wales Premier today about living with COVID. Given the ACT's case numbers, is elimination of the virus still possible here, or is the Delta genie out of the bottle, so to speak?
Well, look, I saw a bit of the Prime Minister's press conference. The media then had to cut away from that to New South Wales to announce another 800 cases, more deaths, more people in hospital, more people in intensive care. So I think it's still a worthy goal in our current outbreak management to try and get our cases, firstly infectious in the community, back to zero, and then overall back to zero. Does that mean that COVID won't and Delta won't come back into the ACT? No, it doesn't, obviously, and will be at risk continuously. And so we've got a short-term task to manage this outbreak and then a medium-term task to have the settings in place to protect the community whilst we continue to get vaccinated. So part of our public health directions and our thinking is about buying that time for all of those people who are not yet vaccinated to get vaccinated. That's what this is about. That's the community effort. That, I think, is an obligation I feel very strongly about, that we owe it to the people who haven't had the opportunity to get vaccinated, the young people, the kids, to give them that opportunity, to buy them the time to get vaccinated. Now, if you choose not to, at the end of all of those opportunities, then we can't protect you. All we can have is herd immunity that might protect you at that point. But I still know tens of thousands of people in this city, hundreds of thousands, millions of people around Australia want to get vaccinated, but still can't yet.
Questions for the Health Minister?
Certainly. No more for me. And that one more. Yes. Okay.
Just on that flower show, Chief.
Yes. Yes, indeed. Usually a big tourism event for Canberra worth about $45 million to our
That's
economy.
what I've heard.
A very legitimate question, Emma.
In light of the tough decision around Floriade over the weekend, what does this tell you about what does this tell us about the restriction settings we might expect to see in the first fortnight out of lockdown if it goes ahead as planned?
Yeah, that's an excellent question. It highlights that we can't run the risk of major community gatherings where hundreds and hundreds or thousands and thousands of people are all congregating in one spot. So it's a pretty clear sign that we're going to have a gentle emergence from lockdown, that it's not just going to snap back to a complete free-for-all. And as I outlined in response to the earlier question, the exercise from the point of zero infectious in the community, zero new cases, is to have the settings in place that will ensure that if the virus comes back in, that we're not going to see an explosion of cases, and that's buying the time for the people who are not yet vaccinated to get vaccinated and to get protected. And so the settings need to reflect that reality, and also whatever else is thrown at us in terms of decisions of other governments, be that New South Wales or the Commonwealth. And we're getting a bit of alpha male muscling up going on at the moment in terms of public messaging. That is what it is. I can't do anything about that. All I can do on behalf of this jurisdiction is respond as best we can to the circumstances. And that means getting more people vaccinated and buying the time for that to happen. Anything else for me? No. Okay, thank you very much. And I'll do a handover to the Minister for Health.
Yeah.
Might Vicky just have any questions for the Chief Health Officer? She's going to have to go to AHPPC, so does anyone have any questions for her?
No.
Okay, right, thank you.
Just on the disability outbreak, why was it so long? Why did it take so long for the community sector and the public to be informed of this? Given a number of providers were, caught up in this outbreak.
So I think, as the Chief Minister said, it's really about the quality of the information that we're able to provide to people. I want to assure people that
both the Office for Disability, Community Services Directorate and ACT Health Directorate have been working really closely with the people who have been directly affected. But in all circumstances when there are clusters, our aim is to try to communicate with those people who are directly affected before making public communications. And that is more complex in an environment where you may have multiple providers, multiple workers, potentially multiple residences involved. And so making sure that that direct communication with people is done before there is a public conversation about it, and that those people have the support that they need in place, we thought was really important. Now, I take on board the feedback that we have received, and it is a judgment call about when you make information public and when you don't. And we've talked before about when we make exposure sites public and when we don't. There was no public health benefit in making any exposure sites public in relation to this, and there was no public health benefit in giving a call out to the broader disability sector, because the team has been working very hard to identify those individuals who are affected by this particular cluster and to provide support to the individuals involved and also to the providers involved to ensure that workforce needs could be met, to ensure that all of those things were put in place. I would, however, indicate to you that the Oversight Group for People with Disability had a special meeting quite early on, and that does include members of the Disability Reference Group. So when people say leaders in the disability community themselves were not engaged and informed, I don't think that's quite an accurate reflection. And as I mentioned yesterday, the Office for Disability then put out a newsletter on Friday, which we considered was the earliest point where it was sensible to let the broader disability community know what was happening and what the response to it was, but to also be assured that by that point, those who were directly involved, so we could assure people that anyone who was directly affected had already been contacted and the supports were already in place for those people. So it is absolutely a judgment call, but it is absolutely also not about hiding any information from the community. It's about making sure that those people who are directly affected get the information communicated to them individually, directly, that they have the supports that they need in place before they hear it through the media.
So given lots of providers were being told and, things spread quickly, the message would have seemed to have already gotten out before it was publicly announced by the ACT government. Isn't that, if people are hearing it on the rumour mill, aren't people just going to be more scared than hearing it from an official source?
Well, I mean, that is a judgment call, right? So people are hearing it potentially. I was not asked about it. It wasn't being such a rumour mill that I was being asked about it in a press conference. Nobody asked me about it on Saturday's press conference or Dr Coleman, or on Friday's press conference before the Office for Disability put the information out. So by Saturday's press conference, the information had been made available to the disability community through the Office for Disability, through their wider networks, and that was an official source of communication from the ACT government, right, to the community. And what we wanted to do, and it was my judgment call on Saturday not to proactively talk about it, so I'm happy to wear that. But what I thought was important was, because the Office for Disability's newsletter had gone out quite late on Friday, that we gave those organisations within the disability community an opportunity to pass that information on to their stakeholders in a way that was a direct communication with them, and then talk about it subsequently in the media. Now, if people think that was the wrong judgment call, that's fine. They can have that opinion. That's perfectly fine. But we did that because we wanted people to hear directly from their community about what was happening through a direct communication from us, in the same way that schools directly communicate with their community, the ANU directly communicated with its community, an aged care provider will directly communicate with its community about what's going on before, if we at all can, before we talk about it publicly. And we only talk about it publicly without that direct communication if it's already become a public issue.
The Chief Minister has said when it comes to vaccination rates with people with disability, you're limited in knowing because of the information you receive from the Commonwealth. But given that, do you at least have a ballpark idea? He says it's likely that it's more than the national average, but do you know for certain?
Sorry, I have that on my phone, which I forgot to bring with me. Thank you. Yes, so I can give you an update. As of Friday, the 20th of August, the Commonwealth advises that 54.5% of NDIS participants in the Territory have received their first dose of COVID-19 vaccination. And again, as I mentioned yesterday, that's higher than the national rate, which is now at 44.9%. And in terms of NDIS participants living in disability accommodation, the figure for the ACT is 74%, so it's gone up very slightly, and again higher than the national rate of 64.9%. And for disability screened workers, the Commonwealth tells us that 54.2% of workers have received their first dose of COVID-19 vaccination in the ACT. So we do get those figures regularly updated, but as the Chief Minister indicated, they are Commonwealth figures. It is a Commonwealth responsibility. It is hard to get figures for the broader disability community, so we have those figures for workers and for people in the NDIS. It is quite hard to get figures for the broader disability community.
So it is a Commonwealth responsibility, given the current situation now with the disability community and this outbreak. Is the ACT government taking steps to try and up that rate?
Oh, we have been taking steps for months now, and I've been expressing my frustration with the Commonwealth response since at least April in relation to particularly the in-reach vaccination of people with disability who live in residential homes and are not able to get to an ACT government facility. But for those who are able to get to a facility, we've set up the Access and Sensory Clinic at Garran, which has been very, very well received, and I gave the figures yesterday as to how many people have been through that clinic to receive their vaccination and how many appointments we have coming up. I don't have those on me today, but we have certainly had a very strong response from the disability community thanking us for our efforts. Our team has been working very closely with providers to encourage them to support residents and their staff to come in and get vaccinated. But we have a way to go, and it has been, as you know, it's been something that I've expressed disappointment about for some time. I think it is also a community where there has been at times throughout the vaccination program a level of hesitancy, and so I really want to thank those leaders in the community who have really encouraged people to come forward and get vaccinated. And I particularly want to acknowledge the leading role that Doogie Herd has played in our community around both making information available to people about the ACT government's response and the vaccination program, but also widely publicising his decision to get vaccinated and giving people confidence in the program.
Are you answering questions on that today?
Sorry?
Court?
Not really, but I'll see if I can.
Okay, just wanted to get an update about on-site testing, and did that all occur yesterday, and about any other activities that took place on-site?
Yeah, so there was a really fantastic multi-agency response yesterday, which did involve testing as many residents as were willing and able to be tested yesterday. That team will be returning to site today to support the testing of any additional residents who may have returned to the site or who may not have been willing or able to get tested yesterday for whatever reason. And that has been an incredible response. And I just want to echo Dr. Coleman's comments in thanking our community partners who really supported the ACT Health Directorate and Housing ACT and Canberra Health Services team to go in there to provide a really person-centred response for the residents at Condamine Court and ensure that they were getting the health information they needed and the support that they needed in what was obviously going to be quite a stressful situation.
Minister, we've heard reports of people who have been in exposure locations being notified by ACT Health as a result of checking in up to a week later. What is the actual time period between checking in or at an exposure location, being notified if you've been at an exposure location? Is there a delay? If so, why?
Look, I'll have to come back to you with some detail on that because obviously if the exposure location wasn't identified until subsequently, then that would probably account for it. My understanding was that it's moving reasonably quickly, but as you would understand with, we've now, I think, around 15,000 close contacts identified. Oh, hang on. 13,500 self-identified close contacts at the moment, but that number has been up to the 19,000 mark. There has been a lot of people to contact. It's part of the reason that, in addition to using the Check-in Canberra data, which has been incredibly useful, we also publicly notify exposure locations as soon as they become available to us to notify, to ensure that people are getting the information in multiple ways. But I'll follow up in relation to the timeframes, and I'll come back to you on that. Maybe we can get a bit more information on the specifics of the circumstances that you're asking about.
And so notifications aren't automated in that sense, so people need to still check the exposure locations. They won't necessarily be receiving a text message immediately when an exposure location is added to the list?
No, so what happens is it's not an automated process through Check-in Canberra. That information is held in the ACT Health database, and then our contact tracing team actually go back, they download the information from the relevant time period for that location, but then they will actually cleanse that data before sending texts out to people, because obviously we use check-in and then a reasonable amount of time that people might have been in that location. So they identify the time period, and then they identify a period of time before that where people might have checked in, and cleanse that data before sending the texts out. So there is going to be some gap between that data being downloaded and the text being sent out. My understanding was it was a reasonably short gap, but with the number of contacts and the number of people involved, that might have expanded a little bit. But we'll get back to you with some further information on that.
Just on the wet weather we're due to expect in the next day or two, a number of testing sites are going to have to close for that reason, and we've ramped up testing last week. We did with the additional opening of new sites. Given we're expected high demand from testing this week, I mean, how do you cope with the system when sites have to close and we're going to be seeing longer waiting times as a result of the rain?
Yeah, look, we'll close down those sites that are drive-through when we have inclement weather and we can't keep them open. But as you're aware, we've got additional testing sites at Gold Creek, at Erindale. I think Erindale is currently closed to the public today as well. So we do have that additional capacity that we can stand up, and we can also expand capacity at Epic and Western Creek up and down as we need it. It is exactly what we're working through at the moment, is how do we ensure that we can meet the demand for that day 12, 13, 14 testing for people who are going to be wanting to come out of quarantine. Particularly those larger school groups, for example, that will all have to go through in a couple of days. So they're working through how they cohort those, make sure that we actually send people to particular locations if we can do that, and do that in an orderly manner, because we know that that demand is coming. Unlike the first few days where we didn't know what the size of our demand was going to be, this time we know what that demand looks like, and we'll work with people to try to manage that as best we possibly can. Of course, we can't do anything about the weather.